I can know what you want. What subject are you struggling with?
Shit. I think my hardest subjects is probably what OBGYN and probably operations. But I haven't really. Yeah.
I say less. During restraint of a psychiatric behavior patient, how many personnel should be present in an ideal situation? When it's time to restrain a psychiatric behavior patient, how many personnel should be present in an ideal situation?
It's between 3 and 5. Let's aim high. Let's go deep.
Is it 1, 3, 7, and 5? You say 5. Survey's going to tell you. 31-year-old female complaining of lower left quadrant pain radiating to her flank. She states it was a sudden onset, no medical history, she takes no medication, BP 132/72, pulse 102, respiratory rate 17. She thinks her last menstrual was 2.5 months ago. Her pain is a 10 on a 1 to 10 scale. Your patient may be suffering from which of the following?
Damn.
A says abrupto placenta. B says appendicitis. C says ectopic pregnancy. D says spontaneous abortion.
Between A and C.
Between A and C?
Yeah.
Pick one.
I'm going
Ectopic.
Well, what is this picking? Yeah, I think it's that.
Rapid fire. Which of the following is the lowest or most inferior portion of the brain? Good question.
That is a good ass question.
Yeah, something that you should know. So A says cerebrum. B says brainstem. C says cerebellum. D says spinal cord. What are you rolling with?
Okay, so cerebrum and cerebellum is probably more important because it's on the brain. The spinal cord is like, get the brain, whatever power. So I'd say the brainstem. Seems like the most least important.
The third stage of labor begins after what event has occurred? A says delivery of the infant. B says there are only 2 stages of labor. C says full dilation of the cervix. D says delivery of the placenta. You rolling with what?
I'll do A.
A. Delivery of the infant, we shall see. Alright, which of the following 3 areas may be used to assess a patient's skin color? A says oral mucosa, which is the lips. B says top of the foot. C says nail bed. D says conjunctiva, which is the eye.
So probably A, the nail bed.
You picking another one or not? You can pick all of them if you want.
Pick all of them.
It's your eyelid when you flip it over.
Oh, yeah.
Survey says.
Man, I thought it was going to be D, but I'm going to go ahead and roll with D.
37-year-old female complaining of pain in her shoulder. Although you believe the pain originated in her abdomen, what type of pain is this known as?
Somatic pain.
Is it visceral, which is A, false, which is B, referred, which is C, somatic, which is D? You say what, somatic?
Yeah.
What is an important first step in trying to stimulate a newborn to breathe?
Back blows, suction the
A says back blows. B says suction the nose. C says tap or flick the sole of the feet. D, position the infant upside down while holding her feet. What are you rolling with?
It's B, suction the nose. You're going to suction the nose and mouth as soon as the baby come out.
Which one you suction first?
It's the nose and the mouth, right?
You want to suction one at a time?
Yeah. You suction the mouth first. Wait, what is it? I think it's the
mouth first. What is the hormone primarily involved in diabetes insipidus?
The hormone?
Yeah, what hormone is involved in diabetes?
Hey, what the hell is insipidus?
Inception. Diabetes in general. What hormone is involved in diabetes? Glucagon.
Probably that.
Antidiuretic hormone, which is ADH. Insulin. Or, oh, Semostatin. What you rolling with?
ANC. Get some glucagon. I'm gonna go with glucagon.
In most cases, altered mental status may be expected. In which three of the following scenarios? In most cases, altered mental status may be expected in which three of the following scenarios?
Long bone fracture, diabetes.
You get to pick three.
I know it's gonna probably be
A says long bone fracture. B says diabetes. C says fall from a 10-foot
I
ladder.
know it's gonna be
D says septic shock.
I know it's gonna be C.
One destination.
Diabetes.
Huh?
See, like if you don't eat or nothing, you'll have some ultimate stats from that. Like diabetes.
If you don't eat, you'll be acting crazy.
I mean, I think they kind of like.
Come on, keep rolling.
And then D, septic shock.
All right, last question.
Shit.
The body maintenance of a stable internal physiological environment is called. The body's maintenance of a stable internal physiological environment is called A. Pathophysiology, B. Metabolism, C. Homeostasis, or D. Diffusion.
Metabolism. It's an internal physical environment. Environmental.
Not at all. What do you think you got?
Shit. I'm rolling 65.
That boy gonna feel it. Ain't no odd numbers.
Exactly.
Survey says
60.
60. What you get listening to BG, dog? Should have rolled with yourself.
Yes.
Let's see. 37-year-old female, pain in her shoulder
Referred
originates from her abdomen. That is referred pain.
Yeah.
If it's pain in the right shoulder,
It's-
it's from the liver.
Right.
If it's pain in the left shoulder,
Mhm.
it's from the spleen. What is an important first step in trying to stimulate a newborn to breathe?
So the feet.
Good. And when it comes to suction, you suction the mouth before the nose, but you just tickle the soles of the feet. That's way after suctioning the mouth. The body maintenance of a stable internal environment. It is called homeostasis. Homeostasis. That's what your body is doing every day, all day, trying to remain in a homeostasis state. That's the ones you got right.
6. 5.
Good. In an ideal situation, how many people to restrain an individual? 5. Let's get 1 for each extremity and 1 to watch the process, because that is a human being you're restraining. Talk the patient through the situation.
Pregnancy, yeah.
Ectopic pregnancy. Left lower quadrant pain radiating to her flank. Sudden onset, no medical history. She's in childbearing age at 31. Pain 10 out of 10. Abrupto placenta, that's trauma. That's 3rd trimester bleeding. When the placenta is torn from the uterine wall. B, appendicitis. The appendix is in what quadrant?
It's in the, I think it's in lower, isn't it lower right quadrant?
Good. So you know that's out.
Yeah.
Instead of lower left, it's lower right.
Lower right, yeah.
In spontaneous abortion, she would have been bleeding and in pain. And the lowest, most inferior portion of the brain, it is the brain stem, because it's well protected. It's the most important part. All your vital signs: cerebrum, right brain, left brain, cerebellum, fine motor movement, and brain stem is all your vital signs. 3rd stage of labor begins after what? Good, you almost got that wrong.
I know, but so was thinking like, ain't no 3 stages.
Absolutely. First stage is
I get that, yeah.
dilation. Which of the following 3 areas may be used to assess a patient's skin color? Get them all right. Oral mucosa, which is the inner lips. Nail beds, or look into the eyes, especially the conjunctiva. In most cases, altered mental status may be expected. Which 3 is it? Diabetes. And is that hypo or hyperglycemia?
Diabetes?
Yeah. Which person would appear with an altered mental status? Somebody with a high blood sugar or low blood sugar?
Somebody with I would say a low blood sugar.
Low blood sugar. Your
Yeah,
brain
yeah.
needs
Hypo, yeah.
blood, sugar, and oxygen. But I wanted 3. You act crazy. The fall from a ladder. Why would this patient present with an altered mental status?
Fell from a 10-foot ladder, so you like you have a concussion or
You can have head trauma.
Head trauma,
You be
yeah.
bleeding in the head and you're losing oxygen. You can act crazy.
Yeah.
And the same with septic
It's
shock.
shock, yeah,
That
septic
patient
is
is
the
in
same.
shock.
Yeah.
One of the first signs of shock is altered mental status. Good. You want another one?
Yep.
My dog, star pupil.
Yeah, 100.